Acupuncture is my life. Acupuncturemylife. Let us begin.
Hello everyone, and welcome back to my show. I'm Dr. Lot, your host and educator from Acupuncture is My Life. Now today I'd like to talk about an interesting case which presented at my office today. A patient presented themselves as diagnosed with manic depressive psychosis. Now for those of you who do not know what that is, manic depressive psychosis is a bipolar affective disorder which is characterized by severe alterations in mood that are usually episodic and recurrent. This mood fluctuates between depression and mania. Now, in acupuncture and Chinese medicine, depressive psychosis is caused by qi stagnation complicated by phlegm misting the heart's orifice. It is characterized by depression, apathy, incoherent speech, dementia, and subdued and nonviolent behavior. In Chinese medicine, this disorder is called Dian Quang. Now, there are 5 etiology and pathogenesis categories to this disorder. Now, one can be due to lack of equilibrium between yin and yang. Another can be due to emotional factors. A third can be due to turbid phlegm misting the heart's orifice. And a fourth can be due to qi stagnation and blood stasis. And then you have a miscellaneous sort of gray area that can be seen as miscellaneous and due to influences from other contributing factors, including heredity, and a person's constitution should not be underestimated. Now, when it comes to diagnosis, there is identification of depressive and manic psychosis. Now we come back to Dian Quang. Dian presents with a yin predominating depressive psychosis, which presents clinically with depression, apathy, incoherent speech, dementia, quiet and non-violent behavior. And Quang presents with yang predominating manic psychosis, which manifests with mental and behavioral hyperactivity, shouting, hostility, and agitation, and violent behavior might also be present. Now, in acupuncture and Chinese medicine, the basic patterns are depressive psychosis, which is called Dian in Chinese medicine, and Dian has 2 representative patterns. The first can be stagnant qi combining with phlegm, and the other can be heart and spleen deficiency. The other basic pattern is called manic psychosis, which is called Quang in Chinese medicine. And the representative pattern of Quang is phlegm fire misting and disturbing the heart, or excessive fire injuring the yin. The basic treatment principle for manic psychosis is to sedate the heart, resolve the phlegm, clear liver fire, and nourish the yin and calm the spirit. The basic treatment principle for depressive psychosis is to soothe the liver qi, resolve phlegm, open the sensory orifices, or nourish the heart and calm the spirit. Now, the case in which I was presented with today was Dian, which is considered depressive psychosis. The basic pattern in which I had to create a treatment protocol for was stagnated qi combining with phlegm. The symptoms presented as depression, apathetic expression, incoherent speech, subdued and nonviolent behavior, suspicion, anxiety, and mood swings. The patient stated that he would talk to himself a lot and pretty much had no appetite. So when it comes to tongue and pulse diagnosis, his tongue presented with a pale and white greasy coating, and his pulse was wiry and slippery. And as a result of my overall diagnosis, I knew I had to regulate the qi, release the constraint, resolve the phlegm, and open the orifices. So I administered point prescription of Xinshu, Ganshu, Pishu, Shenmen, Fenglong, and Danling. And I found that these points combined with others really left the patient feeling really good and in a good mood and interested in his follow-up treatment. But overall, that was my interesting case. Now, there you have it. Don't forget to subscribe to my channel to hear more about interesting cases which I will encounter in the future. And until then, acupuncture is my life. What's yours?